So you want to heal like Wolverine at superhuman speeds, and of course, why wouldn't you? Any injury places us on the sidelines of life. It means we're incapacitated and unable to get back into work, get back into sport, and do the things we enjoy. And if you're anything like me, you hate sitting still and missing out. And it's a question I get a lot. Doc, I've got a marathon coming up in 2 months. How do I fix this tibial fracture? How do I get back to training as quick as possible? Or I've got the surgical scar in my face. I've got prom photos in 2 months. What do I do? Or Doc, she left me, now my heart is broken. I'm going to quickly break down the scientifically proven methods of how to accelerate your healing, whether it be from wounds, soft tissue injuries such as tendons and ligaments, or even fractures. As for the broken heart, have a cup of tea, move on. Now, of course, there are some amazing, fanciful, technical, and expensive treatments out there that can be utilized for wound healing, such as platelet-rich plasma or stem cell therapy. But the things I'm going to recommend are easily accessible, affordable, and will expedite this healing process. The normal healing biological process is a highly programmed, specific chain of events that involves 4 stages. That is hemostasis, inflammation, proliferation, and remodeling. For a wound to heal successfully, all 4 phases must happen in perfect sequence and time frame. But many factors, both local and systemic, can interfere with this process. And in this video, I'll address exactly what to do and what not to do in order to provide your body with absolutely everything it needs to cater this process and make sure that you heal beautifully and quickly. So first of all, just a few things to not do. Number 1 is smoking. This has been well established that people who smoke post-operatively tend to run into far greater complications and have far delayed wound healing. And even cosmetic outcomes appear to be worse. Some cosmetic surgeons won't even operate on someone whilst they are still smoking because of fear of the outcome. Number 2 is alcohol. Alcohol also is an inhibitory factor in the healing process. And when people say it's killing your gains, they're not wrong. About 40% of orthopedic patients who are admitted are intoxicated at the time. That kind of makes sense. They booze up, they do something silly, they fall, they break something. But what they also show is a delayed callus formation. So if you do have a broken bone, it might be tempting to sit at home, nurse the pain, nurse the boredom with booze, but it's really important to try and stay away from that if you want to get back up on your feet as quick as possible. Now, number 3 are medications. Now, there are many different medications that could interfere with the healing process or have some influence, but I want to address one in particular, and that is NSAIDs, or non-steroidal anti-inflammatory drugs, such as ibuprofen, naproxen, and any other drugs that come under this class. We know that the systemic use of ibuprofen, for example, at least in animal studies, has shown that there's reduced proliferation of the cells in the wound, therefore delaying the wound healing. The ibuprofen resulted in a reduced number of fibroblasts. These are critical cells involved in wound healing. It also resulted in reduced wound contracture, that is the closure, a weakened bond, and also reduced epithelialization, which is the covering of the wound. Right, now onto the more exciting bit. Here are the things that you can do at home easily to improve your healing. Number 1 should not come as any surprise, it's sleep. Now, we actually have the US Army to thank for a lot of the research as to why sleep is crucial and what you actually need in order to achieve the best healing, as they wanted to explore the effects of sleep and sleep deprivation on wound healing, of course, for its implications in combat field medicine. So they took 3 groups of people and they gave them all 3 small incisional wounds. Now, one group were given adequate sleep. They were allowed between 7 and 9 hours every night. The other 2 groups were sleep deprived. They were only allowed 2 hours of sleep a night. And what they showed was sleep is king. There's no replacement for it. The group that were allowed to sleep between 7 and 9 hours a night healed almost 20% quicker than the other 2 counterparts. And in the case of sleep deprivation, it appeared that even the nutritional drink could not close that gap and was not anywhere as impactful as just getting enough shut-eye. And it makes perfect sense. Your body needs this downtime more than ever when you're healing. It requires this transition from a wakeful to a sleep state so it can focus its energy on rest and repair. Now, assuming that you are getting enough winks, let's look at exactly how much and of what you should be eating. If you're enjoying this video or finding it even slightly interesting, then I would love to have you along for the journey. Please do subscribe, hit the ring ding ding bell, and it'll be the easiest thing you do today, but it might just benefit you for years to come. At the Mount Sinai School of Medicine, they did a lot of research into what is the optimal nutrition to achieve quick and effective wound healing. So let's talk calories. Well, experts have determined that you need 30 calories per kilogram per day. That amounts to about 13.6 calories per pound. Therefore, you should easily be able to calculate what your caloric intake should be during this healing process. And what about protein, the building blocks of tissues? We know having a wound increases your protein intake requirement. Experts have determined that you need approximately 1.5 grams per kilogram per day to achieve effective wound healing. For a 150-pound person, that equates to approximately 102 grams of protein. But some do speculate that it could be even higher than this, and if you certainly are in a rush and you'd like to absolutely give your body every single chance to heal quickly, you may want to aim for a target slightly north of this. Now, since proteins are composed of amino acid building blocks, some experts suggest focusing on specific amino acids. Arginine is a semi-essential amino acid where the demand of which tends to go up during periods of maximal growth, injury or stress, and it has many different functions including modulation of immune function and wound healing. And arginine is also a precursor to proline, which is involved in collagen deposition, collagen being one of the most quintessential components of the architecture of newly formed tissue. And so because arginine improves immune function and encourages wound healing, under stress conditions the metabolic demand for arginine actually goes up, and its supplementation has been shown to be an effective adjuvant in wound healing. The next amino acid is glutamine, the most abundant amino acid in the plasma, and it's a major source of energy for any proliferating, that is growing cells within the body, such as fibroblasts, epithelial cells and macrophages, 4 crucial cells involved in healing and repair. Now we know that actually the serum concentration of glutamine goes down after surgery, major trauma or even sepsis. And supplementation of this amino acid appears to improve your nitrogen balance and also diminishes immunosuppression. It appears to have a critical role in stimulating the inflammation within the wound to encourage early wound healing. And in studies, oral glutamine supplementation has been shown to increase wound strength and to increase levels of mature collagen, that all important factor. Now thankfully, both of these amino acids can usually be found in branch chain amino acid supplementations, typically that bodybuilders or anyone who goes to the gym or participates in sports might take. So if you are on the healing path, you might want to consider either supplementing with a protein powder or at least, or in addition, a branch chain amino acid supplement you can take in powder or pill form. And if you want to go au natural, then you can find arginine in certain sources such as poultry, pumpkin seeds, soybeans and peanuts. And arginine can be found in rich supply in beef, cabbage, fish and eggs. And what about certain micronutrients and vitamins needed for wound healing? So the critical vitamins and minerals needed for certain stages in the wound healing process include vitamins A, C, E and zinc. These are the major 4, and although a well-rounded diet might be enough to achieve high enough levels in all of these different micronutrients, it is certainly worth considering supplementing. Vitamin C has many roles in wound healing, and we know that deficiency in it causes multiple issues with tissue repair. Just as a demonstration of vitamin C's role, we know when it's absolute worst in terms of deficiency, it causes scurvy and you get the breakdown of tissues. People's teeth begin to fall out, they have bleeding gums, bleeding in their skin. But even minor deficiencies can be linked to inhibited angiogenesis, which is the formation of new capillaries, blood supply, increased capillary fragility, meaning you're more likely to bleed. We also know there's a higher risk of wound infection, which further delays healing. Similarly, vitamin A is also a culprit. The biological properties of vitamin A being that it's a strong antioxidant, it helps increase fibroblast proliferation, and as well as increase collagen deposition. And last of the vitamins, vitamin E. Vitamin E, which is a strong antioxidant, also helps stabilize the cellular membrane integrity. It's a strong anti-inflammatory, and it's also proposed that it might help reduce scar formation. And animal studies have shown that vitamin E appears to be beneficial in wound healing. So lastly, a couple of supplements that are certainly worth putting on the shopping list. Number 1 is collagen. So collagen is a main component of skin. It's actually a marker of aging, as we know that in aging, collagen density tends to decrease. Both human and animal clinical trials have shown that the ingestion of gelatin and collagen hydrolysate has shown to increase wound healing. And this is especially true for diabetic and chronic ulcers. Next is glucosamine and chondroitin. Now these have been taken for a long time by people, for example with osteoarthritis, as these are key ingredients in the formation of many different tissues, including cartilage, tendons and ligaments. They are the raw material to create these different connective tissues. So it makes sense that you should be giving your body enough of these that it can utilize. Now what if you have an exposed wound in the skin? I'm going to mention just a few things that you can actually apply topically to help accelerate the healing. Now firstly, wound care is just massively important. It's really important to both follow hospital or local clinic guidelines when it comes to when to change dressings, keeping it clean, as any infection is what will seriously delay the wound healing process. They may prescribe you certain antibacterial ointments, and I would encourage using them, but you can also get wound friendly ones from a pharmacist that you can apply. There are 27 different studies that show the positive role that antibacterial ointment can have in improving wound healing time. But here are some other things that you might be able to find in your kitchen that can be applied to the wound to help it heal more effectively and at a faster rate. Aloe vera is a magical plant, contains many different vitamins and minerals, and most people associate it with sunburn because of its beneficial effects in skin damage. See, aloe vera contains something called glucomannan, which is a really important component and helps encourage cellular regeneration and also causes the body to produce collagen. And a 2019 systematic review proved that aloe vera, when applied to wounds, seemed to have a beneficial effect, and that was useful for both burns and also open wounds. And this review also indicates that it might be good at reducing inflammation, retaining skin moisture, and preventing ulcers. So a person can just apply a thin layer of aloe vera gel a couple of times a day to a superficial wound. Or you could even soak the bandage in aloe vera too. So next is honey, and this is something we actually still use in the hospital today. It's called Medi-honey because of its antibacterial, antioxidant and anti-inflammatory properties. And a 2016 review showed that honey significantly improved the healing rate of wounds. It reduced scar formation and inhibited bacterial growth in wounds and burns. And in this case, I would advise actually getting proper medical grade honey rather than climbing up your local beehive or getting it from the shop. See, next is turmeric and the paste that you can form from it. See, it contains the active component curcumin, which has antibacterial, antifungal and anti-inflammatory properties. And a 2016 review showed that curcumin seems to stimulate certain growth factors and actually helps to regenerate wounds faster and accelerated the management of wound restoration. And this was followed by a 2019 review which showed that turmeric could increase collagen formation at the wound site. So turmeric can be mixed with warm water to make a paste. This can then be applied to the wound and then covered with a bandage and dressing. And if you do want to use it for a wound, I would suggest limiting it to closed minor wounds, that is where no bone or deep tissue is exposed. Next is garlic. Now garlic has been used for centuries in wound care and was used quite effectively in both World War I and II, as again similarly it has antimicrobial and anti-inflammatory properties. A review in 2020 showed that several different clinical trials have evidenced that garlic is effective in use in wounds. For example, in a randomized controlled trial where they took two groups of participants and gave them each an incisional wound, and in one they used petroleum jelly, whereas in the other they used aged garlic extract. And in the garlic group they healed up to 88% better. So the last tip of the day is exercise, it's movement. Now of course this isn't always easy when you have an injury. It's of course quite natural that when we have an injury it is to recline and rest completely, even during those wakeful hours. But I want to suggest how important movement can be, and as your injury allows, to still take part. And I say to do this with caution. Please don't do anything that could make an injury worse or risk rupturing a wound, for example. But researchers at Ohio State University showed that exercise can speed up wound healing by as much as 25%. But for wound care patients, what is the optimal type of exercise? And it of course will depend on what injury you have and what you can participate in, whether it's swimming for a closed injury such as a ligamentous tear where it's non-weight bearing, or whether you simply lift weights using your upper body for a lower limb injury, or whether it's a wound and you simply go out for a walk, just being sure not to rupture the wound. Whatever you do, just making sure to keep the body active seems to accelerate the way in which it can heal itself. Just please don't go running on broken ankles. So we've gone through a lot, but if I can just quickly summarize then. Avoid the booze and avoid smoking. Avoid medications that delay wound healing as much as you can, such as ibuprofen. Of course, it's very natural to want to reach for ibuprofen when you have an injury, but just know that it may delay the healing process. Ensure enough quality sleep, at least 7 to 9 hours. Aim to eat 30 calories per kilogram per day, and aim to eat 1.5 grams of protein per day, having a greater emphasis on arginine or glutamine or the branched chain amino acid supplements. Supplement or ensure that you get enough intake of vitamins A, E, C and zinc. Take hydrolyzed collagen and consider taking glucosamine and chondroitin. And ensure proper wound care, making sure to apply antibacterial ointments or even utilizing things like Medi-honey, aloe vera and turmeric paste or garlic as mentioned, all of which can actually be taken orally or as a topical treatment. And lastly, keep moving. Don't let this injury beat you. As always, please do discuss with your physician before starting any treatment. And I do hope you got something from this, and if you are someone with a broken leg or a broken heart, then perhaps you can use some of this to get back to it. Please do subscribe if you want any more content like this. I'll always be giving, I hope, valuable and concise information as it relates to everyday problems, everyday health concerns, and helping you optimize your life to make it long and wonderful. Anyway, all the best, and it's been fun.